Hey everybody, Joe Betcher here again with another Ultrasound of the Month video. So Dr. Payton seems to be dominating this competition, although I'll be honest, she didn't know that she found such a cool finding until I pointed it out to her on a review of her ultrasound. A 70-year-old patient came in with left-sided atraumatic 100% vision loss in her left eye. So she thought to do an ultrasound to rule out a detachment. So she scans through the posterior chamber and she correctly rules out a detachment. But as she's scanning through, there's something in the top right corner over here that doesn't look quite right. The posterior chamber, which is right here, should be completely hypoechoic or completely black. But instead, there's a bright white or hyperechoic ring that we see. This is a lens dislocation. These are extremely rare. Notice how the lens isn't attached to the posterior part of the iris and the pupil anymore, but rather floating in the posterior chamber? This isn't good. How do you diagnose this without an ultrasound machine? Well, heck if I know, but with an ultrasound machine you see that this is actually pretty reasonable. The most common symptoms that these patients have is a monocular diplopia, that's the answer for the Board's test, or a complete vision loss, which is what our patient had. So they correctly sent her over to ophthalmology and she had surgery, fixed up her lens, and is good as new now. Just as a refresher, this is what a retinal detachment looks like. You see it attached to the retina and it seems to swirl, yet be firmly attached when the patient moves their eye back and forth. Finally, this is a vitreous hemorrhage. You see the mildly hyperechoic swirling stuff in the posterior chamber, which is blood. All three of these diagnoses can present with pretty similar symptoms, so they're all going to need to see an ophthalmologist. Hopefully this was helpful. Thanks everybody.